my 12 steps are verify care / order for the patient, perform hand hygiene, verify faculties, policy and procedure, or facilities policy and procedure, consult with manufacturer's recommendation when it comes to using equipment, knock on door, identify patient using 2 forms of identification, note overall care of patient, explain the procedure to the patient, elevate bed to promote good body mechanisms, don PPD if indicated, lower bed, raise side rails, give the patient the call light, and report any abnormal findings to my charge nurse. So I have an order to initiate an IV at 0600. So I'm going to come into the room and I'm going to find a vein. So I'm going to take my tourniquet and tie it. And now I'm going to find my vein. So I'm feeling around and I see a good vein right there. So what I'm going to do is release the tourniquet. I'm going to clean the area. So I'm going to open my kit. And I'm going to clean the area in a circular motion, starting from the inside and working my way out. I'm going to let the air dry on its own, and while I'm doing that, I'm going to set my equipment. So I have my tape ready. I have my tegaderm that I'm initial dating and timing, putting to the side. I'm going to prime my pigtail. So I'm going to connect my saline to my pigtail and make sure that it's potent and there's no air bubbles, so it's potent, and that's good. I'm going to look at my needle and make sure that there's no shearing and that there's no abnormalities and it looks good. So I'm going to recap it for the time being. I'm going to wash my hands, apply my gloves. I'm going to reapply the tourniquet. Okay, now I'm ready to insert my needle. So make sure that the bevel is up, and I'm inserting at a 10 to 15 degree angle. So I'm going to pull the skin back to make sure that's taut. I'm going to insert my needle. And advance my catheter. And pull back. And then I'm going to apply pressure to this to occlude the vein. I'm going to grab my piggy tail and connect it. Okay, now that that's connected, I can remove the pressure, and I'm going to remove this tourniquet. I'm going to pull back to see if there's any blood, and I'm going to flush the line, and it looks like it's potent or patent. So, and then I'm going to get the tape. I'm just going to tape this hub. And I'm going to get my tegaderm that has been initial dated and timed and apply it over my hub. And then I'm going to occlude this line for the time being. Disconnect my saline. And then I'm going to tape this to the patient. I'm going to assess the site for any redness, soreness, ask the patient how they tolerated it. and I'm going to document the procedure that I did. So now I have an order at 10 o'clock for 2 milligrams of morphine IV push stat. So prior to administering my medication, I'm gonna follow the 6 rights, which is right drug, right dose, right time, right route, right person, right documentation. So for 2 milligrams of morphine, I'm going to dilute it with 5 mLs of normal saline. So I'm going to mix that medication up, and then I'm going to ask the patient if they have any allergies. I'm going to make sure that the respiratory rate is within normal ranges. But also assess their blood pressure and their pulse. And I'm going to assess their pain level as well. So I'm going to attach the medicine, and when I push, it's not going to be a fast push. It's going to be a push that's 4 to 5 minutes. And prior to doing that, I'm going to flush it. Once I administer the medication, I'm going to flush it again to make sure that the line is patent. I'm going to return to the patient in 20 minutes. First, I'm going to assess their pain level, and then I'm going to assess their respiratory rate, blood pressure, and pulse. I'm also going to listen to bowel sounds. And also as well, I'm going to assess the site to make sure there's no inflammation, phlebitis, and then after I do all that, I'm going to document my findings. So now it is 1 o'clock, 1300, and I'm ordered to start a normal saline drip of 150 milliliters per hour over 8 hours. So first one I'm going to do is flush my line. And my line is still patent. I'm going to clean the hub. I'm going to connect my saline to my patient. I'm going to set my drip at 150 mLs per hour over 8 hours. I'm going to assess the patient, and I'm going to document what I've done.